Hey everyone, and welcome back to the Unseen Wisdom. Don't forget to like, comment, and subscribe so you don't miss out on any of our future deep dives.
Definitely.
Today, we're diving into a situation unfolding in South Africa.
Okay.
It's about healthcare specifically, the challenges facing aspiring doctors, and the government's response or lack thereof.
Right.
So to kind of set the stage for this deep dive, we're going to be looking at reports, interviews, and firsthand accounts from doctors themselves.
Yeah, that's right.
To try and understand how South Africa finds itself with unemployed doctors, while also grappling with a shortage of healthcare professionals.
It's really a layered issue, with a lot of moving parts.
Almost like a paradox, right?
Yeah.
You have this group of qualified, eager individuals who have dedicated years to studying medicine, complete their mandatory community service, and are ready to serve their communities, but they're facing unemployment.
Yeah.
They're being turned away from hospitals that desperately need more doctors.
And that's where the frustration stems from.
Yeah.
We're seeing over 1,800 junior doctors unemployed.
Wow.
With some regions like the Eastern Cape, an area with significant healthcare needs, explicitly stating they can't absorb any more doctors.
Think about the emotional toll that takes on these young doctors, you know.
Oh, absolutely.
You've poured your heart and soul into this demanding profession, you're ready to make a difference, and you're met with closed doors.
Yeah.
It's disheartening, to say the least.
It is.
And it raises some serious questions about how the South African government is managing its healthcare system and prioritizing its workforce.
For sure.
And it's particularly jarring when you consider the doctor-to-patient ratio in South Africa.
Right.
They're currently at 0.3 doctors per 1,000 people.
Wow.
Which is significantly lower than the World Health Organization's recommendation, at least one doctor per 1,000 people.
Yeah.
And this isn't just about numbers on a page.
No.
It has real consequences for healthcare access and the quality of care people receive. And what's even more perplexing is the fact that while South African doctors are struggling to find employment, there are reports of foreign doctors being hired to fill positions.
Yeah.
This has understandably led to some frustration and a sense of being overlooked by the very government these doctors have trained to serve.
And this is where the narrative becomes particularly sensitive.
Okay.
When South African doctors voice their concerns about this discrepancy, they're sometimes met with accusations of xenophobia.
Oh, wow.
It raises a complex ethical question.
Yeah.
Is it xenophobic to expect your government to prioritize your employment when you've invested years of training and resources to serve your nation?
It's a valid question, and it's important to acknowledge the nuances of this situation. On one hand, you have qualified professionals who feel their dedication and sacrifice are being disregarded.
Right.
On the other hand, we need to be mindful of avoiding discriminatory practices based on nationality.
Yeah.
It's a delicate balance, and finding a solution requires empathy and understanding from all sides.
Absolutely. It's crucial to listen to the perspectives of both the unemployed doctors and those who might perceive their concerns as xenophobic.
Yeah.
Open dialogue is essential to finding a path forward that addresses both the need for equitable employment opportunities and the importance of fostering an inclusive society.
So what's the government's take on all of this?
Right.
We have statements from Health Minister Dr. Aaron Motsoaledi acknowledging the doctor shortage,
Okay.
but highlighting budget constraints and austerity measures as the main obstacles to hiring more doctors. He even draws a comparison between doctors' unemployment and general unemployment.
Oh, really?
Suggesting there's no special treatment for the medical profession.
Wow.
And this is where some of the criticism arises.
Okay.
Critics point out that previous health ministers, like Dr. Joe Fila, had promised funding to hire more doctors.
Right.
This perceived inconsistency in messaging and action creates a sense of distrust and uncertainty, especially for those who are directly impacted by the unemployment crisis. And where does this leave the aspiring medical professionals?
Right.
The students currently in medical school and those considering this path.
Yeah.
What message does this send to them about the future of their chosen profession in South Africa?
It's a valid concern.
Yeah.
The current situation could have a chilling effect on those considering a medical career.
Right.
Why dedicate years of your life to a profession that might not offer you a job in your own country?
Right.
This potential brain drain could have long-term consequences for the South African healthcare system.
It's like investing in the development of world-class athletes, only to have them compete for other countries.
Exactly.
The investment is made, the potential is there,
Right.
but the benefits are reaped elsewhere.
Yeah, and in this case, the loss is not just about individual talent,
Right.
but about the potential for improved healthcare and the well-being of the entire nation.
So we've got a situation where qualified doctors are being turned away from jobs.
Yeah.
Foreign doctors are being hired.
Mm-hmm.
The government is citing budget constraints.
Right.
And aspiring medical professionals are facing an uncertain future.
Yeah.
It's a lot to unpack, and we're just getting started.
Indeed. This is a multifaceted issue with far-reaching implications.
Okay.
Let's delve deeper into the proposed solutions,
Yep.
particularly the National Health Insurance Scheme,
Okay.
and the potential impact it might have on this complex situation.
Okay. Sounds good.
So let's shift our focus to the National Health Insurance, or NHI,
Okay.
which the health minister believes is the key to transforming South Africa's healthcare landscape.
Okay.
It's an ambitious plan aimed at providing universal healthcare coverage for all citizens, regardless of their income.
On the surface, it sounds like a noble goal.
Yeah.
Equal access to quality healthcare for everyone. Who could argue with that?
Right.
But as we've seen with the doctor shortage, the reality on the ground is often far more complex
Yeah, you're absolutely right.
than policy proposals might suggest.
The NHI's success hinges on more than just good intentions. The commentator we reviewed raises some valid concerns about its feasibility,
Okay.
especially considering the existing challenges within South Africa's healthcare system.
What kind of challenges are we talking about specifically?
Well, for starters, South Africa already allocates a significant portion of its GDP to healthcare,
Okay.
around 8.5%,
Wow.
which is comparable to many European countries.
Okay.
So the issue isn't necessarily a lack of funding,
Right.
but rather how those funds are being managed and distributed.
That makes sense.
Yeah.
The health minister himself has highlighted the current inequality in healthcare spending,
Yeah.
stating that a disproportionate amount of the budget, 51%, goes towards supporting only 14% of the population.
Wow.
That's a pretty stark illustration of the imbalance the NHI aims to address.
Exactly. The idea behind the NHI is to pool resources and distribute them more equitably, ensuring that everyone has access to quality care regardless of their socioeconomic status.
Okay.
But the commentator we read argues that without addressing the systemic issues that contribute to this unequal distribution, the NHI risks becoming a larger pot of money vulnerable to the same problems.
It's like trying to fill a bathtub with a leaky faucet.
Right.
You might be pouring in more water,
Yeah.
but until you fix the leak, you're not going to solve the problem.
That's a great analogy. The commentator is particularly concerned about the issue of corruption within the healthcare system.
Right.
They argue that until those issues are tackled head-on,
Yeah.
the NHI could simply amplify the problem by creating a bigger, more complex system
Okay.
without resolving the underlying inefficiencies.
The health minister has downplayed the significance of corruption,
Right.
claiming it's not unique to South Africa, and that the NHI isn't a magic bullet solution for all healthcare woes.
Right.
But how can we ignore such a critical issue when considering such a massive overhaul of the system?
It's a valid point. Critics argue that failing to address corruption directly could undermine the entire NHI project. It raises questions about the government's commitment to transparency and accountability,
Right.
which are essential for building trust in any new system,
Yeah.
especially one as ambitious as the NHI.
And let's not forget about the unemployed doctors.
Right.
Where do they fit into this grand vision of universal healthcare?
Yeah.
Will the NHI automatically create thousands of new jobs for them?
That's a key question, and the answer is far from clear.
Okay.
The health minister suggests that equitable distribution of resources will naturally lead to an increased demand for healthcare services,
Okay.
resulting in more job opportunities.
But is that a guarantee?
Not necessarily. Critics argue that without a concrete plan to address the root causes of the doctor shortage,
Right.
things like inadequate infrastructure, bureaucratic hurdles, and yes, even corruption,
Yeah.
the NHI could end up being a costly and ineffective endeavor.
Right.
It might even further demoralize the very doctors it's intended to help
Wow.
by creating a larger, more complex system
Yeah.
without actually resolving the underlying issues
Right.
that led to their unemployment in the first place.
So what are we left with?
Right.
Qualified doctors ready to work, a government grappling with budget constraints,
Yeah.
a proposed massive overhaul of the healthcare system, and a whole lot of uncertainty.
Right.
It feels like we're standing at a crossroads.
Yeah.
and the path forward isn't exactly clear.
That's true.
What stands out to you as the most crucial aspect of this situation so far?
For me, it's the human element that often gets lost in these policy debates.
Yeah.
We're talking about real people,
Right.
doctors who have dedicated their lives to healing patients who deserve access to quality care, and an entire nation grappling with the complexities of a strained healthcare system.
Yeah.
We need solutions that prioritize their needs and aspirations,
Right.
not just balance sheets and political agendas.
I couldn't agree more. It's easy to get caught up in the statistics and the technicalities. But at its core, this is about people's lives and their well-being. So we've talked about the doctor shortage and the NHI and the concerns of both the government and unemployed doctors.
Right.
But let's not forget the most important stakeholders in all of this.
Yeah.
The patients.
Of course.
How is this situation impacting their access to health care and the quality of care they receive?
That's a crucial point. A shortage of doctors has a ripple effect throughout the entire healthcare system.
Okay.
It can lead to longer wait times in emergency rooms, delayed surgeries, and difficulty getting appointments with specialists.
It's like a bottleneck effect, right?
Yeah.
When one part of the system is strained, the entire flow is disrupted.
Exactly. And this shortage also puts immense pressure on the doctors who are currently working.
Right.
They're often forced to take on heavier workloads, work longer hours, and make do with limited resources. This can lead to burnout, compassion fatigue, and ultimately compromises in the quality of care they're able to provide.
The South African Medical Association has raised concerns about the aging doctor population,
Right.
pointing out that without a younger generation to fill the gap, the long-term outlook for healthcare in the country is pretty bleak.
Yeah, that's another layer of complexity to consider.
Right.
If qualified young doctors can't find employment in South Africa, they're more likely to seek opportunities abroad.
Yeah.
This brain drain not only exacerbates the existing shortage, but also represents a significant loss of investment for South Africa.
It's like cultivating a garden, nurturing these young plants.
Right.
Only to have them uprooted and transplanted elsewhere just as they're about to bloom.
Precisely. And it's not just about the numbers. We're losing talented individuals who could be contributing to the advancement of healthcare within their own communities.
So given this complex web of challenges, what are some potential solutions?
Right.
How can South Africa address the immediate concerns of unemployed doctors while also ensuring the long-term sustainability of its healthcare system?
There's no easy fix.
Yeah.
Okay.
But several strategies could be implemented.
Okay.
One is to increase government investment in healthcare, not just for the NHI, but also for creating more job opportunities for doctors within the existing system.
That would require a shift in budget priorities, wouldn't it?
It would. Another critical step is addressing the root causes of the shortage, including corruption, inadequate infrastructure, and bureaucratic hurdles that hinder the efficient allocation of resources.
And what about the NHI?
Yeah.
Could that play a role in alleviating the doctor shortage?
The NHI's potential impact is a subject of much debate.
Okay.
Proponents argue that by creating a more equitable and efficient healthcare system, it will naturally lead to an increased demand for doctors, thereby creating more job opportunities.
But critics worry that without addressing those fundamental issues we've discussed, the NHI could simply expand the system without resolving the underlying problems that are contributing to the shortage in the first place. Exactly.
Okay.
It's a bit like expanding a restaurant without hiring more chefs or addressing inefficiencies in the kitchen.
Okay.
You might have more tables, but you're not actually equipped to serve more customers effectively.
So where do we go from here?
Right.
How can South Africa find a way to balance the need to address its doctor shortage with the financial realities of its healthcare system?
That's the question we leave you with. This is a multifaceted issue with no easy answers.
Okay.
But by understanding the perspectives of all involved, the doctors, the government, and most importantly, the patients, we can start to envision solutions that address both the immediate and long-term challenges facing South Africa's healthcare system.
It's a conversation that needs to continue, a dialogue that needs to involve all stakeholders.
Absolutely.
We encourage you to delve deeper into this issue, explore the various perspectives, and most importantly, share your own insights and potential solutions in the comments below.
Thank you for joining us on this deep dive into the complexities of South Africa's doctor shortage.
And don't forget to like, comment, and subscribe to The Unseen Wisdom for more thought-provoking explorations of the issues that shape our world.
Definitely.
Until next time.